Hey guys, welcome back to my channel. I am so excited to be back on YouTube here talking about skincare.
You're back!
Yes!
We should have a bottle of champagne.
I did that already on my last video.
Okay.
Yes. So we are back and I am so excited. We have Dr. Ben Johnson from Osmosis here.
It's good to be back.
Yes, it's been too long.
Ugh. The drama.
Yes.
And I was, I did get to hear a lot of the details along the way, and it's been crazy, but you've heard about that already, so we're going to focus on other things.
We're going to focus on good things.
Good things.
Good things moving forward.
Being healthy, getting healthy.
Yes, and as you guys know, I always talk to you guys about internal wellness and, focusing on your skin from the inside out.
Yes.
And Ben is the person to go to when it comes to focusing on the inside out, because he has helped me with my skin so much, internally and obviously topically through his products, but he is like a genius when it comes to internal health.
We're getting amazing results, so thank you very much for that.
Yeah. So we're going to talk about internal health today because honestly, what you do inside your body comes out on your skin. So let's talk about internal.
Where should we go?
Yeah.
Well, what I would say, and I want to just echo what Brianna said, and of course, Brianna's always been at the forefront talking about new ingredients and exciting new things, and since we've not had the opportunity to do this for a while, there's so many exciting new things. What I've realized over time is that there's so much that we can do to change our health and affect our skin. So I know a lot of you watch Brianna's videos to learn how to look younger and more beautiful, and I'm telling you, since you've last seen me speak here, we have come up with a couple of products that are really revolutionary, if I may say so myself, and I'll just start with my first favorite.
Is this your favorite?
This is probably my favorite. Well, I mean, it's because I just launched this. So this
I love that.
Yes. Yeah. So this is called Recovery. This is a prebiotic. So the first thing I want to teach you about is that probiotics actually are trying to put bacteria into your gut that aren't necessarily yours. So the whole problem with the probiotic scene is that you have your own DNA designed bacteria that grow within you. It's not off-the-shelf bacteria. We don't all have the same 10 strains. And yet when you go to the store to buy probiotics, what you see is they often have similar strains or some mix of strains, and you've got some chemist somewhere who's like, oh, let's give them this strain. And what I'm here to tell you is we can actually replace the strains your body wants. And so what a prebiotic is, which is different than a probiotic, is something that actually restores your natural probiotic population without trying to throw someone else's bug decisions into your life. And what's happened as a result of that is we're helping people with SIBO, we're helping people with H. pylori, we're helping people with constipation, bloating, gas. Like, it's a 3-month process to restore your gut health.
Because isn't when your gut is off, that's when you see a lot of bloating and all of those issues. And then once you fix your gut, you have less bloating, you feel better, you're just like...
Well, what's happening is those bugs are trying to break down the food you're eating, and they're not the right bugs, or you don't have enough of the bugs to break down the food you're eating, and so all of a sudden your body struggles and you start to get the gas and the bloating and these different events. So yes, it's true, sometimes you can take a probiotic and get lucky that a strain helps you. But in general, the clinical trials showed, and this is how I got to my place, is I looked at the clinical trials, as I often do, and the clinical trials showed that when they gave someone an antibiotic, in other words, they hurt their gut, and then they followed whether or not they would get better faster without anything at all, or with a probiotic, they learned in that study they get better without anything at all. So I started down the path of looking at prebiotics, and all a prebiotic means is it's a superfood for your digestive tract. Your bugs love it, and they thrive on it, and it just takes 3 months to restore almost everyone's gut health. Now, if you're someone listening and you have leaky gut, then you might need 4 months of this. So that's one super exciting piece of this. It helps with moisture. I don't know, here, you don't have dry skin.
Oh yeah, no, it gets dry here. Yeah.
Okay, so and I'm working on getting Brianna on the protocol, so she doesn't actually. We haven't resolved her dry skin from the inside out yet.
Yeah.
But one of the coolest things about this is it literally restores the lipids that are a big part of dry skin. So you think there's 2 ways you have dry skin. One is you over exfoliate, or you remove the oils from your face because you're too aggressive with your cleansing, or your products are too stimulating. But the other way is that you're not getting enough nutrition to feed your skin the proper lipids.
That's so interesting because a lot of people do not think that. They just slap on moisturizer all the time, and
they think you think, and even my moisturizers, they're not really designed to restore the inherent moisture in your skin. They're designed to put like a temporary sense of moisture. So what this is doing is it's actually bringing the lipids back into your skin, and you do see a restoration in moisture. I'm telling you.
This has all the omegas and stuff.
Yes, it has every omega in the perfect balance. So it's already an omega supplement. So this would replace your omega supplement. It would replace your probiotic. It has multiple uses. But wait till you hear the unbelievable story, which is about how it affects your fat pads. So it turns out that when you see your face age, you lose volume in your face. And the way you lose volume is you have these fat pads that are worked in your muscles. They're not sitting on the surface. They're not what make your cheeks chubby when you eat too much at Christmas. They're literally the structural fat pads that you were born with. So if you think back to when you were in your teens and 20s, or some of you are in your teens or 20s, so you're in good shape.
For now.
Yeah, for now. Oh, this is a great, like you can take a teaspoon a day. Someone like that would do a teaspoon a day. If your gut's in good shape because you're young, that's how you would do this as a maintenance to keep your gut staying strong. But what happens is each decade of your life, your body depletes those fat pad volume. And that's why everyone's doing fillers right now, because they're actually trying to compensate for the lost fat pad. Well, the problem with that is it's not perfectly contouring with your natural beauty, right? You're always having to kind of shift how your face structure is and chasing that, and you can see we've seen some celebrities go nuts with it, and their cheeks get in the room before they do. But so it is a like I'm trying to think of who's a classic one of this. It was, and some of them have gone back and they've tried to get rid of their fillers. So who's the one on Friends? Not Jennifer Aniston. But Courtney Cox.
Yeah.
Courtney Cox went nuts, right?
Yeah.
And then she had a retraction. So they're all trying to figure out, where should I put my fillers? And the answer is this. Like, this is the first ever. It's patent pending because we're getting such an amazing result. It literally restores the lipids in your face over about 3 to 4 months. It takes 6 to 8 bottles total to get that volume back in your face. There's a whole set of fat pads. So let me tell you where the fat pads are. That's kind of cool. So there's all these fat pads in your forehead, and they go right between your brow. And then there's fat pads under your eye. And then there's fat pads around your mouth. So all the people that are getting marionette lines, all the people that have the lines in their lips,
that's helping.
This is helping. And it helps about 80%. Like we're not getting you back to, 12 years old.
Yeah. I wish.
Yes, I wish that. I'm going to keep working on that. But you'll see that, and we keep getting these amazing before and afters, because even some of you that might be in your 60s, 70s, and 80s, I don't know if you've done your demographic. There's probably some of those.
Oh, totally, yeah, for sure.
That is where it's the most dramatic, because you've lost so much volume. The skin is starting to, the gravity's pulling on it, and so you get your nasolabial folds get deeper, right? And you get the marionette lines like we talked about. Wrinkles. 80% of wrinkles, by my estimation, based on all this research I'm doing, are caused by the loss of volume in your face. Hence why so many people are doing fillers. So with this, you're actually going to restore the lipids in that area. I'm telling you, you're going to love those results.
Yeah.
And then you feel better. Like when your gut's better, you can eat more bad food.
Yeah.
I mean, I'm not telling you to eat bad food, but you can tolerate more.
Yeah.
There's just so much, there's so many people who are struggling with gut health. So such an amazing
And then gut
product.
health, if you don't have a healthy gut, that's what I would say too. Like, you have internal issues with your gut, it comes out in your skin. You have more skin conditions.
Oh, yeah. And you're almost always going to be, if you remember, I think we did skin mapping. I'm sure we did
a long time ago.
So we talk about where the digestive zones are. So if you're really red right here, this is your small intestine zone. If you're red around this area, this is your large intestine zone. And if you're red right here, this is right at the end of your intestine. A lot of times people with constipation will get red right here. But what this does is it activates repair of all of that. And I mean, the feedback has been so phenomenal. I promise you this will be something that you will not regret. And then one of the questions I get all the time is it permanent? Do I have to keep taking it the rest of my life? It is what I'll call semi-permanent. And what I mean by that is, you were born with full fat pads. It took 3-4 decades to get to where you are in your current diet. To where that, and alcohol and sugar are the main things that I'm finding are depleting your fat pads. So the more sugar you have, the more alcohol you have in your teens, 20s, and 30s, the faster this all depletes. So what I mean to say here is, this is like a 20-year effect on your fat pad if you're living a clean life, maybe 30. But if you are, you know, still partying hard, we got you covered. But you know, you might have to do this every 10 years or something like that. But that is amazing, right?
But do you want to keep using it? Do you want to keep using it to help with like the dry skin and the gut health? Well, that's like there's like a maintenance phase to that.
There
too,
is
right?
maintenance. So the maintenance is between a teaspoon and a tablespoon. I choose a tablespoon, and I mean, yeah, it's been phenomenal for me. And it does seem to, like, it's in the first 6, and everyone's a little bit different. So you say, was it 6 bottles? Is it 8 bottles? Well, it depends on where you came in. Did you come in with a really depleted fat pad volume? Oh my gosh, and I'm going to tell you one other thing. Fat pad is not just in the face. Fat pad is your butt shelf. Yes. Yes.
That's what all women want.
Yes.
The big round butt.
Yes, but I'm not telling you it's not the dimply, sagging, droopy fat butt. It's intramuscular. And I'm telling you, reports are coming in. Your butt lifts a little bit because there's a fat pad on
that's true, actually. That's good.
Because I mean, I saw it when, you know, it's probably not appropriate I talk about my own butt.
Your butt was lifted?
But no, but I saw my butt volume decline.
Yeah.
Like, people used to make fun of me because I had, you know, a bubblicious booty, and now and then as with aging it was starting to go down. You see that, like, older men, like, we all lose our butts. This restores 80% of that. It's crazy.
Wow,
so crazy. But also in the arms, so like intramuscular, in the thighs. And again, this is not the kind of, oh my god, it's going to make my legs look fat.
Right.
It's going to make your
it helps your muscle. Like, it helps, exactly.
It's like that
it firms.
That makes you look strong, rather than, you know how if you start starving yourself, you start to look really, you just look too thin.
Skinny
you don't
fat,
look
they
healthy.
call it. Skinny fat. Yeah.
And so this is actually
muscle.
bringing your muscle volume back, which makes those quads pop when you're wearing your heels and all that stuff. So it's you know, it almost seems too good to be true. And when I formulated it and I had that intention, I wasn't sure how good it was going to be, but the before and afters tell the story. Take a picture of your face before you do this. I have
seen some before and afters, and it's phenomenal.
Phenomenal.
Yeah.
Phenomenal. So I'm so excited about that product. It's one of my fan favorites at the moment. All right,
let's talk about this, because you guys have heard me talk about this on my Instagram.
Oh yeah.
On here,
awesome.
I have been obsessed.
This is okay, and you were talking about she thinks she's noticing the hair changes.
100% hair growing faster because of this.
This is a hair, skin, and nails formula on one side of it, but that's really not what is the most remarkable part of it. So this formula, the reason why I even created this formula was because.
Well, let me first say it's called the Liver and Collagen Renewal.
Yes. Yeah. Regenerate Liver. Yeah, I should say the name. Regenerate Liver and Collagen Renewal.
Yeah.
So I made it to help rebuild your collagen and feed it in a targeted way, and I'll explain why it's so different than like the collagen drinks. I don't know if you've ever tried those collagen drinks. I'll explain the difference in a second.
Ooh, that's actually really good too, because people ask me, like, what's the difference between this and like collagen powder that you know, like all that.
Yes, I'm here to explain that to you. So, but there's this the thing that was my main emphasis was liver spots. I could not get to heal that liver because we have this product called Immune Activator that is really good for melasma. But I couldn't get to the liver spots. They're actually a different type of damage in your liver. And so the people would be like, well, when are you gonna, what am I supposed to do about those spots? And before now I would always say, well, you can use tyrosinase inhibitors, right? You know, the usual suspects. But with this, it actually is creating liver repair. So what you find is your liver spots, okay, I'll tell you what happened to me. My liver spots started to peel. You're here, all you're doing is taking pills. I didn't put anything on my face for that. They just started peeling and then fading.
That's so crazy.
It's so crazy.
I've actually had multiple people say to me that they started taking this and their hyperpigmentation like faded away even.
That's what that's what we're doing here.
Yeah.
And so what it really proves is that your hyperpigmentation does come from the liver, which is a concept pretty much I think I launched. You know, most people are like, come on, it comes from hormones. I'm like, it does come from hormones, but hormone damage to the liver. So you'll see your spots fade over about a 3-month period. Some people might need 4 months to complete the process. But let me tell you, I don't know if you've noticed, my wrinkles got better in over that time. Like I visibly saw changes in my wrinkles from that, which has me so excited.
Is that from the collagen?
Yes, because well, it's not collagen. So let's talk about that. So why would you want to drink a collagen drink, and how do the collagen drinks work in comparison? It's a really important question, and it's very confusing. Like we have pros. I mean, I know a lot of these people aren't necessarily the SD pros. The pros are confused about how do I make sense of what, you know, the marketing.
All these different collagen supplements and drinks and
which one's
powder.
better? Well, okay, so I'm going to give you a couple tidbit facts for you. Number one, when you're ingesting collagen as a supplement, I would always recommend you try to find collagen that most mimics your skin. So you're looking for hide collagen, not bone collagen, right? Because bone collagen has a different you know, combination of types of collagen. There's several different types of collagen. I won't bore you with all of the different types, but it doesn't really feed your skin. And so you take that collagen, it goes into your stomach, and it breaks into amino acids. So the amino acids go wherever they go in your body, and if some people are a little short in amino acids, a collagen drink will they'll notice their hair, they'll notice their nails, and they might notice their wrinkles. I highly doubt it. I'll explain to you why this is different. But I've not heard a lot of people say, well, I really saw my wrinkles get better. They all kind of say, well, maybe my skin looks a little more glowy or something. Trust me, that is not from the amino acids. It's just sort of, you're kind of almost creating it in your mind. And that's my take. Listen, if you had a different experience, I apologize, but that's been my take, because I spent a lot of time studying collagen, knowing that, well, really, I didn't even know, this is a pretty recent concept that I came up with. So I was planning to ignore the collagen thing. I didn't think it worked very well, and then I learned about something. There's an ingredient we've talked about in the past called alpha-ketoglutarate. It's called AKG, and what it does is it accelerates collagen manufacturing. So you know how vitamin C helps you make collagen? When you eat a lot of, or ingest a lot of vitamin C, it does not increase your collagen production. They've studied that. But when you ingest a lot of AKG, which does the same thing that vitamin C does in your deep skin, it does accelerate collagen. So what's happening here is I've put in the perfect blend of amino acids and a bunch of that alpha-ketoglutarate to accelerate the activity, and you will visibly see your lines change. Please, again, take a picture, because it's subtle and slow, but it keeps progressing over 3 months. And I think it's going to keep progressing. I'm only on 2.5 months right now, so I think it's going to keep progressing. I plan to stay on it for a while. I'll let you know if there's like a point where it's really obvious. Like for fat pads, honestly, I don't see anyone who's ever needed more than 8 of these in order to get to that place. Oh, and by the way, this is 1 tablespoon twice a day to do the fat pad protocol, and it's 1 tablespoon once a day to do the digestive health protocol. And it's very important. You don't do 2 tablespoons in the morning. It will not help you do fat pads. It's really interesting. Your body needs to have them separate up. Okay, so back to this. This is 6 capsules a day for 3 months. It's that easy. And there's liver extract in there, because like heals like. So I looked at AKG, and I looked at I was like, how do I come up with the components that the liver needs to heal itself? You go to cow liver. It's very similar to human liver. So we found a farm in Argentina that is essentially organic, but it is not certified organic. And we put the AKG in, we put the blend of amino acids in, and I couldn't believe it, because in the first month, 2 weeks in, and I'm not expecting this to happen to everybody. I've not heard this is happening to everybody. My whole face was peeling. Really? But gently, but it was like, what's going on? And it was literally because it's creating collagen renewal. I mean, it is doing that. So you might see that, and I'll warn people, some people might see their liver spots popping and hiding, and like your face might do some weird things. You might see a patch of redness for a couple of days. Everyone has it differently, and depending on how sick your liver is, you might, it's working on actually repairing your liver. So what does that mean? What happens when your liver's better? I can tell you one thing I noticed. Your metabolism goes up. So you start to get the youthful metabolism. One of the coolest, and then, this is beauty, and there was no plan to have a metabolic effect in my mind, but what I realized after being on it for a while was when your liver's healthy, you have the metabolism of back when your liver was healthy as a 20-year-old. Oh, yeah. So you can tolerate more foods. I mean, I'm just burning fat from it. So it's a really exciting protocol. It's amazing, that stuff. And when your liver's better, your immune system's better. And we're going to talk about immune system next.
Yeah. This is all around literally the best supplement. I love it. Like I said, and even just like on like a hair, nails, and everything, I'm like, this is what makes my hair is growing so much faster with that.
It only used to be to here
like a month ago.
It has the most bioavailable form of vitamin D in it, and it has a bunch of other benefits. I mean, liver is actually one of the most nutritious foods you can eat. And I feel sorry for all the vegans and...
Or just people that think that would be disgusting.
Vegetarians, or the people that are like, ooh, cow liver? Well, listen, I don't eat liver. You'll never see me order liver at a restaurant. I do not. But it's in a capsule. You know, it's...
Yeah.
You know, you swallow it and it's gone. You don't even think about it.
taste it or nothing like that.
Right.
Yeah, exactly.
But when your liver's better, your immune system's better, your metabolism will be more youthful. You'll see it in your face, and your brown spots start disappearing. Now, I haven't had anybody... I didn't have any liver spots on my arms. Remember, your arms and your hands are liver spots. So I anticipate that those will also fade away for you.
Yeah, it's not just your face.
But when you do melasma, these two together, immune activator and regenerator, what you need. And because melasma is a more serious, so it takes 3 months on both of these, and your melasma, oh man, I just saw a picture the other day. Woman really like impacted on her whole face with melasma, and she was so excited because she was, I think, 6 weeks in, and she'd already seen a huge change in her melasma. So
I'll leave all these like combinations down in the description box so you guys can reference that. But yeah, so the immune activator, which is an internal dropper supplement, and then this regenerate for melasma.
We used to just do this for melasma, but it would take twice as long. So when I added regenerate, it enhanced the liver repair activity of this. And this is something you should be considering right now anyway, because
for immune support.
Health.
Yeah.
Because the molecule in it is an oxygen.
I'll open it up.
Yeah, sure.
Yeah.
The molecule is a stabilized oxygen that your immune cells use to fight viruses. It literally is going to help you fight viruses better. We've seen this. Yeah. People are reporting it, and yes, and it's a natural tooth whitener, which is crazy.
It does.
But it actually pulls the yellow off of your teeth.
Yeah, and this is just a little dropper. You take one drop, I put it under my tongue.
Yeah, and then, just leave it in your mouth.
Yeah, and I swallow
for 5 minutes. Oh, you do? Right away?
No, for like I leave it in for a little bit.
Okay.
Yeah.
So it's better not to swallow it unless you don't like the taste. So immune activator, one dropper full a day for people who are immunocompromised will really help boost your fighting power should you actually get infected with the virus or any other virus, to be honest. It's really good during flu season and all those things.
Yeah, so talking about COVID and, that is what we're all, dealing with right now. Let's talk about...
Oh, yeah, the frequency elixirs. So what you're looking at here is immune defense. I will just tell you, when the FDA made a call for the virus to look for anybody who had a treatment that seemed to be effective, I contacted them. I actually submitted the immune defense as a protocol for what's going on right now. And the reason I did that was because we are having phenomenal success. So if you're somebody who right now is struggling with it, it's 2 doses, and the doses are by weight. So if you're 100 pounds or less, and your children as well, then 1 bottle is enough. But if you're just over that limit, she would have to take a bottle and a half. So 1.5 bottles in the morning, 1.5 bottles 12 hours later, and most people notice that their symptoms diminish rapidly. If you have a fever going on, your fever ends within 24 hours. And if you are somebody who had it and you're still struggling, it's amazing to help shut down the symptoms. Because, some people, the virus stays in them, and it's just sort of smoldering in the system.
Right. So this will help kind of like...
It shuts it down.
Yeah.
It just shuts it down. And so, very few failures in this whole process. And I don't know if you know, but my practice is every day I'm helping people like yourselves. You can write me and through Brianna, and write Brianna and say, can you get Dr. Johnson to help me with my situation? She'll forward that information to me. So it has been a very, very effective tool. It's super easy, 2 doses and you're done. And really, for viruses right now, what is there for viruses? You know, there's not really a medicine for it, right?
You can't do anything,
You go take your cold and flu, that's not treating the virus. In fact, it's probably not good for you. But so that's a super exciting. It's called Immune Defense.
And honestly, even with like sore throats,
yes,
I have noticed I have gotten sore throats and I felt like I was getting sick, so I will take a bottle of that and just drink it, and then the next day it is completely gone. It is so insane.
2 doses for the current virus, but like the typical cold virus, 1 dose.
Yeah.
1 dose is enough.
And it's gone. It's insane. I give them to my kids when they start feeling sick. It helps them. Like, that stuff is just the best.
And listen, I have some colloidal silver in it, and I have some edible 24 karat gold flakes in it. Don't be distracted by that. I mean, because you know, colloidal silver right now is getting a bad rap. That's not what's working here. What's working here are the frequencies. So you're like, what do you mean, Dr. Johnson? Frequencies? Now, most doctors don't talk about frequency medicine, but I do have a device. I've been doing frequency medicine for years. I have a few clinical trials under my belt that were highly successful. I promise you this will be very effective for you, or you reach out to me and I will keep working with you until you're better.
So, do you want to finish up with the last two?
Let's cover a couple of
We'll finish the last
products.
two because I love both of these. Too,
yes.
So.
Yes. So
these are like my favorite thing in the world.
Digestive support. Yes. So when we talk about getting your health back, a lot of people have acid reflux. And remember in my mapping, if you have acid reflux, one of the tells is you have capillaries on the sides of your nose. That is a sign that you've got more significant damage. And the funny thing is, about 1/3 of people don't feel it. So you may not even know you have acid reflux, except for that little marker your skin is telling you, hey, watch out. And
that's going to come out on your skin. Like, you're going to see, if you're suffering from acid reflux, you can have
your nose gets red.
You can get, I was going to say,
some rosacea symptoms can show up. So you take 1 to 2, usually most people can do 1, but if you're eating like a half a pizza, like I just did, you take 2. And so you, and through that process, what you're doing is you're putting in the digestive enzymes that your pancreas makes. And that makes it easier on your stomach. See, the whole reason people have acid reflux is their stomach's trying to compensate for the fact they don't have enough enzymes. And I don't know all the reasons why the pancreas enzymes seem to decline as we get older, but this makes all the difference. So if you're struggling with digestive
bloating
problems,
too, those really help with bloating.
Yes, because you're breaking the food down better.
Yeah.
And a lot of people think, oh, but wait, I take an antacid for that. Please don't take an antacid, because all that does is it reduces your breakdown of food, and that leads to all kinds of problems.
Yeah, that is the best thing, for sure. I've noticed a huge difference with, like, when you eat, you would get, like, bloated or something afterwards. That just, you don't at all. I even take those right before I go to bed. Oh. And then it just helps, like, digest, I guess, throughout the night. And I wake up and I'm like, flat stomach.
I support that concept. But all right.
I did this one.
And the last one for today is another one of my favorites. It's called Skin Clarifier. It's the only mucus cleanse in the world. Have you done this one?
Yes, I did a while back. Yeah. It helps with, like,
acne.
Yeah, or like little blackheads, like
blackheads.
Yeah.
So blackheads, I've learned, and again, this is all stuff that's pretty much coming from my own research. You know, I've been doing skincare and wellness for 20 years, and I am, I'm not a practicing MD, so I have spent all my time talking with people like yourselves or other estheticians or other doctors, and I kept just accumulating information. And what I learned was mucus is a big part of acne. Oh, excuse me, and it is the cause of blackheads. So you see blackheads here and you go, well, why are they here and not over here? Well, that's because this is your digestive zone. So blackheads are coming out in digestive zone. I just started another cleanse myself. Sometimes you have to do it every 6 months, especially if you're a big dairy lover like I am.
Yeah, because dairy builds up the mucus in you.
Yes, dairy is a mucus former.
Yeah.
Fried food is a mucus former.
Yep.
So those are the things that are leading to acne. I was talking to a young girl the other day who struggles with acne, and her favorite food is chicken fingers, which are always fried.
Yeah.
And so she was forming mucus, and it was causing her. And you think, well, okay, well, if I stop eating chicken fingers, will my mucus go away? No, it sits in your gut like
for a while. You got to like get rid of dairy out of your diet, and then it's got to be out for like a good amount of time.
There are people who clean their diets. Oh, and that's the other thing.
And it's still stuck in there?
If you're one of those people, yes, because if you're one of those people who said, but wait a minute, diet and acne, I don't know, Dr. Johnson, because I cleaned up my diet and I still have the acne. What's that about? Mucus. Mucus stays around. You cleaned up your diet and it could take your system years.
Ugh, yeah.
It may not go. There are people who have what we call mucus plaques where it just stays.
Yeah. So this helps pull all of that out.
Yes.
Yeah.
And you can either need 1 to 3. So sometimes when people have really bad cystic acne, they end up needing 3 cleanses. This is a 10-day cleanse, so you might need more than 1, but I'm telling you, it is so good, and it's good for digestion, and it's good for the skin, and it's the main reason I use it is acne. It is a really important part of acne, especially all the acne that happens in the upper face. So if you're watching and never heard me talk before, this does, you know, and you're always like, why? I keep taking antibiotics, or my doctor
that messes up your skin even more.
Yes.
Yeah.
Or my doctor wants me to put me on Accutane.
Yeah.
Please don't do Accutane.
Yeah.
This is the holistic solution. All this stuff is good for your health, and it makes your skin, restores your skin health.
Yeah, because when you go to the doctor and they just prescribe medicine, it's not the same. This is like healing.
Well, an antibiotic is literally poison to your body.
Yeah.
You're made of a lot of bacteria. So you're taking it, it's like chemotherapy, antibiotics. It's not something that you should consider lightly. Like a lot of people are like, an antibiotic. It's like, it's good for you in a way because you have an infection. That's not what acne is. Acne is not caused by an infection in your skin. I know that is going to come as news to many of you, but this is something over 20 years I've learned. We have a 99% success rate. I've been looking at my past cases. Very, very rarely do we have a failure. So let me help you. Let's work with Brianna to get their skin clear.
Yeah, for sure. If you guys have any questions, leave them in the comments. But I think that wraps it up for this video, all on our internal, health and wellness, which I am the biggest fan of because of this guy right here. He is literally said the genius of internal health. So
thank you.
Thank you so much for watching, you guys. I will leave all this information down below in the description box so you can open up there. These products are now found on skintruth.com. So you can, open up the links down below. But we will have Dr. Ben here for another video. So stay tuned.
Yes.
And we'll see you guys soon.
All right.
Bye.